Hello there, my name is Jay. I'm one of the expert OET teachers here at e2language.com, where you can prepare for your OET tests. Okay, we've got a lot to get through in this video. What we're going to do is this. We're going to look at what each of the OET subtests looks like. It's really important that on test day you know what's going to be in front of you. Now, there are two formats of the OET test, the paper-based version and the computer-based version. I'm going to show you both so you know what's coming. Also, we're going to look at the facts of each subtest. That is, how long they go for, time management, how many speakers in listening part C, whatever, all of that sort of stuff. It's just good to know that. Just good to know what the test is about. Also, I'm going to tell you what you have to do in each subtest, okay? Because sometimes it's not quite clear, especially for like reading part A or even the writing subtest. What do you have to do? So I'll talk to you about that. We're also going to look at some tips, not tricks. I don't believe in tricks. A lot of these YouTube videos that you'll see talk about how to hack the OET exam and how to memorize this structure. This is not true, and just be very careful how you prepare for your OET. You really do want to get good information, and I believe that E2 Language delivers good information. Finally, we're going to just look at how best to prepare for this test, okay? Even if you're a native English speaker, you're still going to have to think carefully about how you prepare for this test. You can't just rock up on test day, take the speaking, take the writing, and think that you will pass, because there are things called criteria. There are different things you need to consider, okay? Anyway, we're going to cover it all in this video, so keep watching. Okay, first of all, just as a very broad overview, OET has what are called subtests, okay? They are the listening part A subtest, listening part B, listening part C, reading part A, B, and C. There is the writing subtest, and there is also the speaking subtest. So all up, there are in fact 8 parts to this OET test. Cool. Okay, let me give you an overview of listening part A. Okay, so if you're taking the paper-based test, this is what the exam paper will look like in front of you. As you can see, there are gaps that you'll need to fill, and I'll talk more about that in a minute. If you're taking the computer-based exam, it looks almost identical, except this one is digital, and you have gaps where you will type the text in, okay? Pretty straightforward. You sort of already know what you have to do. You're going to have to listen to a conversation. You're going to have to write down words or phrases to fill those gaps from the conversation. Okay, so let's learn the facts about listening part A. So there are actually 2 parts. So you're going to hear 2 different conversations. The first conversation will have 6 questions. Then you're going to hear an entirely different conversation between 2 people with another 6 questions. So 12 questions in total. The first conversation might be a dialogue between, say, a patient and a physiotherapist. The second one might be a dialogue, say, between a patient and a dentist, okay? So medical professionals talking to a patient in a conversation. Now, what's important to understand here, and this is a little tip, is that answers come, I'm just going to say almost entirely, okay? 99% of the answers will come from the patient. And what you need to do is note down a specific word or phrase to fill that gap. It's not as easy as it sounds. It's definitely worth doing some practice of this. One last little tip I'll give you is that spelling is not counted in listening part A. So if you do spell a word wrong, doesn't matter. It's cool. It's marked by people, humans, who will say, I think what she means is this, and they'll give you the point. Okay, let me give you an overview of listening part B. So if you're taking the paper-based test, this is what you'll see in front of you. It's pretty straightforward. It's a multiple choice type question with 3 answer options. It does require practice though, because it kind of moves quite quickly. There's actually 2 sections to the question prompt, and then there's like the context setting, then the question prompt, and the audio moves quite quickly. They're quite short audios. Anyway, that's what the paper-based version looks like. This is what the computer-based version looks like, almost identical. You'll just click on one of those answer options to confirm that that's the one you choose. Here are some facts about listening part B. So you're going to get 6 questions on test day, and they are short, monologues or dialogues. That is, there'll be one person speaking or two people speaking. Sometimes it gets confusing because it'll be two people speaking about somebody else. So, for example, a doctor and a nurse talking about a patient. So it's pretty important when you're listening or when you're, again, look at the methods lessons for this, which is really critical, where we go deep into the best approach for this type of question. So as I mentioned, there'll be 3 answer options and you'll be listening for different functions. What I mean by that is, let's say the first one, you'll be listening for an overall understanding. So what is the speaker talking about? What is the doctor talking about? The next one, you might be listening for a detail. Why does the nurse suggest this or something like that? Or what is wrong with the patient's whatever? Okay, so maybe a detail. Might also be a question in there about purpose. So why does the doctor recommend whatever? So there's different functions and it's really good to be aware of those functions before test day. So when you are listening, you're like, okay, I'm listening here for an opinion or listening for an inference or listening for a detail, etc. That helps to break it up and to understand that. Okay, let me give you an overview of listening part C, and this is where I think the listening section becomes quite challenging. Okay, this one's tough. So this is what listening part C looks like if you're taking the paper-based test. Again, multiple choice question, 3 answer options. And this is the computer-delivered version. Same thing, you'll need to click on one of those answer options. Here are some facts about listening part C. So in this one, it's not short audio files. It's a longer excerpt and it's going to be like a lecture with one person speaking, or it's going to be an interview with 2 people speaking, okay? Now, you're going to receive 2 on test day. So you get the first one, which might be the monologue or the lecture, and the second one might be the interview, okay? So there's actually 2 separate parts to listening part C on different topics with different speakers. So for each of these longer excerpts or extracts or audios, you're going to get 6 questions for each part, so 12 in total, 3 answer options, and again, you'll be listening for different functions, okay? This one differs slightly from listening part B. In this one, there will be questions about opinions and attitudes, okay? So how does Mr. Smith or Dr. Smith feel about X? Or how does what does she think of this, etc. So opinions and attitudes will also be a part of the gist questions, the detail questions, possibly inference questions, etc. Okay, so by now you're probably thinking, I should probably do some preparation for OET because it looks kind of straightforward so far, but it would be nice to know if I'm ready to take OET because it's quite expensive and it only happens like once a month. Maybe I should take a mini mock test with feedback. That's a good idea because E2 language has exactly that. Let's check this out. So the mini mock test with feedback from E2 language covers all of the different parts of the exam: listening ABC, reading ABC, writing and speaking. The good thing about it is it's going to provide you with feedback on how you go on each of those subtests. The writing subtest, you'll actually submit writing through to our experts who will then grade it and mark it according to the criteria, send it back to you. And you can also, for speaking, take the one-on-one speaking mock test with feedback with one of our expert teachers. Really good place to start your preparation. And if you've actually taken OET before and been unsuccessful, but you're unsure why, it's a great tool to find out what's going on and how you need to improve. Okay, let me give you an overview of reading part A. This subtest is kind of different, okay? So you do need to pay attention here. This is what the paper-based OET reading part A looks like. There's going to be 2 parts. You're going to have, on the left-hand side, you can see text A, text B. These are the texts, which has to be the hardest word in English to say, texts. These are the texts. You're going to get 4 of them, right? Some are short, some are longer. One will always be a visual, that is some sort of graph or flow chart or diagram or something like that. But there'll be 4, A, B, C, and D. On the right-hand side here, you can see the question booklet, okay? And you're going to get different questions, which I'll talk about in a second. So on the computer, if you're taking the computer-based version of OET, it's very similar, okay? You get your texts, you get your questions on the right-hand side. Easy. Okay, so here are some facts about reading part A. As I mentioned, there are 4 texts, A, B, C, and D. These are on a single topic. Maybe it's low blood sugars or pimples. I don't know. Something pretty generic, to be honest. You're going to have a series of matching questions. In which text can you find information about this? A, B, C, or D. Then you can have short answer questions and gap fill questions where you will actually take a word or a short phrase directly from the text to answer the question or to fill the gap. Okay? We're going to talk more about this in the methods lessons on e2language.com though. So make sure you watch those methods lessons where we deep dive in, look at an approach for how best to complete this subtest or any of the subtests successfully. Now, it's important to know that for reading part A, you'll only have 15 minutes to complete 20 questions. This very much is a speed reading test. That is 1 question every 45 seconds or so. You have to move fast in this. Again, you don't want to rock up on test day not entirely understanding what reading part A is about, okay? You do not want to open up your test booklet and go, oh my God, I've got to spend 3 minutes working out what to do. No. On test day, you rock up, you open that booklet, you're like, yes, I know how to do this. Thank you, E2 Language. Okay, by now you would have realized how wonderful these videos are, and you might want to just click that subscribe button because we do release really good OET preparation videos nearly every week, okay? So do click the subscribe button. And also, if you're serious about your OET preparation, like you need to pass this test and it's probably a pretty good idea that you prepare, check out e2language.com. We have got you covered, I promise. Okay, let me now give you an overview of reading part B. Reading part B is pretty straightforward, okay? This is the paper-based version, and you can see it is a multiple choice style question with 3 answer options. You can't see the entire text there, but they are short texts, and you just have to circle one of those options. This is the computer-delivered version, and it looks pretty much exactly the same. You just have to click one of those answer options. Here are some facts about reading part B. So you're going to get 6 of these questions. They each have 3 answer options. They are short workplace texts. So they might be signs or some sort of little definition or something that you'd see in a hospital or a clinic, okay? And it's going to test you, like on listening, it's going to test you on different reading functions. You'll be reading for something, like a reason why, or you'll be reading for an overall idea or a detail or an inference, different reading functions. It's good to practice these so you're familiar with the different types of questions so you can nail it on test day. Now, I should mention here that reading part A, which we talked about before, is timed separately to reading part B and C. Reading part A, as I mentioned, you get 15 minutes. Then after that, they take your exam paper, or in the computer-delivered version, you can take a break. Then you get 45 minutes to complete reading part B and C together. So really what this means is you need to manage your own time now in reading part B. And we recommend that you spend about less than 2 minutes, actually, on each of these reading part B questions. So you leave yourself plenty of time to complete reading part C, the 2 parts of reading part C, which I'll talk about next. These questions in reading part B, however, can be pretty tricky. And again, prepare before test day. What you don't want to do is rock up on test day and look at these questions and sort of think, oh my God, whoa, this is intense. I don't really understand what's going on, etc. You want to rock up on test day and be confident and go, all right, I can get this one. That's B. Okay, now let me give you an overview of reading part C. If you're taking the paper-based version, you will see something like this. On the left-hand side, you can see the text, and it's a long text. It's going to have about 7 or 8 paragraphs. And on the right-hand side, you can see the questions. These are multiple choice questions with 4 answer options. Now, one good thing about this reading part C subtest is that the question prompt will tell you in which paragraph you need to read to find the answer. If you look at number 7 there, it says in the first paragraph, or what do we learn about sleep in the second paragraph? So you know exactly where to read, okay? And yeah, multiple choice, you'll just be circling one of those answer options. If you're taking the computer delivered test, this is what it looks like. It's almost identical. You just click on one of the answer options there. Here are some facts about reading part C. So you'll get 2 long texts on different topics. Each long text will have 8 multiple choice questions. Each multiple choice question will have 4 answer options, and you'll be reading again for different functions. Okay, so again, you'll be reading for gist, main idea, you'll be reading for detail, you'll be reading for purpose, you'll be reading for opinion, you'll be reading for attitude. You might even be reading for knowledge of vocabulary. Sometimes there'll be a word or a phrase that'll be emboldened or underlined, and it will basically say, what does this word mean? And you need to work that out from the context of the paragraph. So there are a range of different questions that you'll see in reading part C. Again, good idea to practice them. Okay, let me give you an overview of the OET writing subtest. This particular subtest is the most difficult. In fact, if you look at the statistics of test takers around the world, it's writing where most people are not successful. Okay, this is an important subtest to get right. Let's take a look at it. If you're taking the paper-based version, you'll see something like this. You'll see a set of case notes where you can see on the left-hand side. Below the case notes, you'll see the writing task, which is really critical. And in the methods lessons on e2language.com, we talk in depth about how to approach this particular subtest, because there's a certain way that you'll write the letter that will evidence the criteria, okay? What I mean by that is the examiners have a checklist of things that you need to do in your letter, things that you need to write, certain way that you need to write. And if you write in that certain way, you're going to get a good score. That's a fact. If you don't write to the criteria, you may not get a good score. You're just sort of using luck, okay? So make sure you learn that criteria. Again, e2language.com has that information. Now, what I haven't shown you here with the paper-based version is the actual piece of paper where you write your letter, but it's just a very standard lined piece of paper where you write the letter, okay? On the computer, it's going to be a little bit different. Looks like this. You'll still get your case notes on the left-hand side, and on the right-hand side, you'll get your little text input box where you will type your letter. Cool. Here are some facts about the OET writing subtest. So, when you first start it, you'll get 5 minutes reading time. During this reading time, you cannot use your pen. You have to sit there and just read and think, and perhaps start to think about relevance of case notes and structure, etc. Then, after the 5 minutes, you can begin writing, and you'll have 40 minutes to write your letter. The length of your letter, it's a little bit sort of complicated. Basically, the length of the body of your letter needs to be between about 180 to 200 words, but it's just it's not very strict. It's not like other English language tests like the IELTS or PT Academic or TOEFL, where you must hit a certain threshold. OET is different, and we'll talk more about that in the methods lesson. Okay, the case notes that you'll get will be profession specific. And usually, if you're a doctor or a nurse, you'll be writing a referral, discharge, or transfer letter, okay? I think radiographers write an information letter, but if you're a doctor, nurse, or dentist, it'll be referral, discharge, or transfer. And what's critical, what I mentioned at the beginning, are the criteria. The criteria, again, are the checklist that the examiners cross-check your writing with, and either you have written to the criteria in which you'll get a good score, or you haven't, okay? It's critical that you understand that. Now, if you want writing feedback, which I highly recommend, it's very difficult as a test taker to sort of know if you're doing it right or not, because it's coming out of your subjectivity, and you need somebody else, preferably somebody who really knows what's going on, someone at E2 Language, for example, who will look at your letter and give you detailed feedback on that criteria. That could be the difference between failing and passing on test day, because you might get some feedback from us where you go, Oh, okay, I won't be doing that in the exam. I've got to remember to do this, and then you do that, and then you'll pass, okay? Writing feedback is critical, but it should come from the right person. Let me now give you an overview of the speaking subtest. So, if you're taking the paper-based OET test, you're going to be taking a face-to-face speaking subtest, okay? It will be with what's called an interlocutor. The interlocutor is basically a conversational partner. In other words, the person you're speaking to on test day, face-to-face, is not the examiner, okay? This person you're talking to is like a performer or an actor. They're just going to be performing the role play with you, conversing with you, and your role play is going to be recorded on a device, sent somewhere else where examiners will listen to it. And like the writing, they're going to be cross-checking your speaking with what's called criteria, the checklist. Are you doing this, this, and this? If yes, you're doing well. If not, you're not doing well, okay? Now, and you can see here also a role play card. So you're going to be performing a role play. We'll talk more about that in a second. Now, if you're taking the computer-delivered version of OET, you'll be taking it on Zoom, and it will be just like it is on E2 language when you take the mock test or one of our speaking intensive packages. That is, the role play card will be screen shared with you on Zoom. You'll be performing just the same way. You'll be looking at the role play. You'll see the interlocutor. It's pretty much the same. It's a really good idea, though, for either the paper-based face-to-face or the computer-delivered to make sure you do one of these speaking mock tests before your test. You really do want to get a feel for it, okay? Because it is a little bit unusual. It is a little bit strange, and maybe you can practice with someone in your house, your husband or wife or whatever, but it's a really good idea to get some good feedback from an expert. Here are some facts about the speaking subtest. So there'll be 2 5-minute role plays. They are profession specific. So dentists will be talking about teeth, and physios will be talking about muscles and anatomy, and doctors talk about lots of different things, and nurses talk about lots of different things, but they're profession specific. You'll have 2 to 3 minutes to prepare for the role play, okay? That is, you get 2 to 3 minutes to read through the role play card, and you get to hold the role play card during the role play, and you'll be referring to the role play card. And if you want to learn more about best approaches for the speaking subtest, watch the methods lesson. It's critical. The role play card is going to provide you with some information. It will provide you with a setting. Maybe you're in an emergency department. Maybe you're doing a home care visit. It will provide you with a scenario, background about the patient, what's been going on with the patient. It will also provide you with tasks. And these tasks might have multiple parts, and you need to work your way through the tasks in 5 minutes. It should naturally come to an end at about the 5-minute mark. Anyways, lots of strategies and lots of things to think about in the speaking subtest, including the all-important criteria, okay? Just quickly, you're also scored in 2 different ways. You're scored on linguistic criteria, that is your language skills. That is your intelligibility, your pronunciation, your grammar, your vocabulary, the appropriateness, the tone, etc. So there's language. You're also scored on what's called clinical communication criteria. This is more like your bedside manner. This is more like how you communicate with the patient in that medical context, and the way that you use empathy, and the way that you ask permission before moving on, and the way that you pick up on certain cues that the patient might drop. There's lots of quite interesting stuff there actually to learn, and very importantly to use on test day. Okay, thanks very much for sticking around. Remember to check out e2language.com if you're seriously serious about passing your OET test. Highly recommend it. We've got expert teachers, live classes, tutorials, writing feedback, practice questions, methods lessons, overview lessons, everything you need. Did I say the mock test? Check this out. So this, again, is the mini mock test with feedback. This is the best place that you can start your preparation to get a feel for the exam, simulation, but also that critical feedback so you know exactly what you're doing right and wrong. You know exactly what to focus in on before test day. And if you need additional help, like you might need longer time with the teacher, check out this. This is the one-on-one tutorials that come as part of the bronze, silver, or gold package. You can focus in on a particular subtest. You can do a couple of different subtests. You could do writing and speaking or reading part C and listening part A. It's totally up to you. One teacher, one expert teacher, one student, that'll be you, 45 minutes, one-on-one. Cool, anyway, hopefully that video provided you with a good overview of what OET encompasses. It hasn't gone into too much detail, it's just giving you a pretty broad overview, and it's the methods lessons where you'll find the best approaches for each of these subtests, okay? There's quite a lot to learn if you do want to maximize your scores. Anyway, my name is Jay. Thanks very much for watching. Hopefully I'll see you over on e2language.com in one of the live classes.